Good morning, good afternoon, good evening, anywhere you're watching this video from. I'm back again, your nurse Rose. Please like, subscribe, and share this video. Today, we are here to talk about infections. Infections, many people, both male and female, we deal with infections, and it's common, it's rampant everywhere. But I will talk on the one that is more common, like is a common infections, but people we don't know, we don't even care, we don't check ourselves because these infections, some of them don't come with symptoms, some don't have signs. So you will not even know, you will look healthier, you will look very smart, good, but you don't know that infection is eating you up inside. So one of these infections that we are going to talk about today is human papillomavirus infection. Human papillomavirus infection. This infection is usually transmitted by sexual transmitted infection, and is very common but powerful. Common but powerful. Like this human papillomavirus doesn't have symptom. It don't have symptom. You will not even know that you have it. This infection is a leading infection that causes to cancer. This infection, if you leave it untreated, you have cancer. Doesn't mean that someone that have human papillomavirus is going to have cancer, because some immune system can, that is strong, will fight it like 1 to 2 years, it will clear. But those weak immune system, if you leave it untreated, it will lead to cancer, and that cancer will be cervical cancer, mostly in women. This infection is not going to cause only cervical cancer, because it's going to cause both vaginal cancer, vulvar cancer, anal cancer, and some throat cancers. So as a woman, you are not supposed to leave your body like that. Even men, is applied to men too, because this infection causes infertility. This infection is a very common viral infection that some people don't know that they have it. At some point of their life, they don't know that they are exposed to this human papillomavirus because it doesn't have symptom. Some people ask, how is this human papillomavirus being transmitted? I will tell you. One, skin to skin sexual contact. Your boyfriend or your girlfriend might say, baby, I don't like using condom, I like it skin to skin. Remember, there is human papillomavirus. So you can practice safe sex. You get, this is the most common way human papillomavirus spread, and it can be passed during vaginal, anal, or oral sex, skin to skin. Then the second one is genital to genital contact. Genital to genital contact. Human papillomavirus can spread even if there is no penetration. Even if there is no penetration, close contact between the genital area is enough to transmit this virus. Is enough to transmit this virus. So it's not even only if you have sexual intercourse, skin to skin with your partner, then you have it. Even without penetration, you have it. As long as your genital touches the other person's genital, you will have it. Then the third one, but not the last, is a contact with an infected person's skin. If that person have a wound, and that person have this human papillomavirus, and your skin touch it, you have gotten it. Or mucous membrane, you have contacted it. This virus enter the body through tiny cuts. It enters the body through tiny cuts or abrades in the skin, especially in the living genital area. It enter your body through a tiny cut. Another one is from a mother to a baby, and this one is very rare. It's very, very rare. You get, because a mother that have this human papillomavirus can transfer it to the baby during her childbirth. And this might cause the baby throat problem or voice box. It can affect the baby seriously. Then we can ask, can condom protect this and prevent this human papillomavirus? Condom, yes, condom, if you practice safer sex with your partner, condom reduce the risk. It doesn't protect, it doesn't give you the guarantee, it reduces the risk of this human papillomavirus to be transmitted. But like I said, it doesn't provide the complete protection that you need, because this thing can be transmitted not only through sexual contact, it can be transmitted to genital contact, skin. So if that person even have it, if that person have it, condom cannot cover everywhere in your body. Some of your body will be open. So if that person have, if your that person's skin touch your own skin, you have contacted it. So condom, yes, reduces but not full protection to it. Some other people can ask, can someone have this human papillomavirus without knowing? The answer is capital yes. You can have it without knowing, because this infection, most people with this don't know because it doesn't have symptom. You feel completely healthy, you are eating well, you are okay, you feel completely healthy, you will not know. Then people can still pass this virus to their sexual partner because they don't know. This one is not HIV that you be have seen the symptoms all over your body, or you have some other infections like candida infection, you'll be seeing some discharges from your body, you will know that you have infection. This one you don't know because it doesn't have a sign, so be careful. Some ask, how can this human papillomavirus be treated or prevented? One, you can use a human papillomavirus vaccine before being sexual active, if possible. Then secondly, you can practice safer sex, like example like condoms, but condom reduces, not full protection of it. Then you can limit to number of sexual partners, can limit. Then woman should have regular cervical screening. Should have regular cervical screening. Like example, this pap smear. You can go to hospital, tell them that I want to do pap smear or for HPV test, depending on the local guidelines, because some doctors and some hospital might direct you, take this one this month, you get, do this one next month. So women, you should do cervical screening. Pap smear is very important for this infection so that you will know how your body is going. How often should a woman be screened? For me, a woman, you are not supposed to sit for a person to ask to go and run tests on your body, because we all know that our body is very open. So but for these particular infections, it depends on the approach you get and the country. Because from the age of 21 to 29, pap smear test, you do it like every 3 years. Then the age of 30 to 65, you have these HPV tests for 5 years, every 5 years, or pap smear every 3 years, or both if recommended by your doctor. So some women or some patients, men and female with HIV or weakened immune system, may need a frequent screening. You will need a very very frequent screening. Someone also ask, who should receive this vaccine? Everybody should receive it. Boy, a girl at the age of 9 to 14 years, you should receive it, because this age is the best age for you to receive it, because it will prevent you before being exposed to this human papillomavirus. Then how many dose will you take? 9 to 14 years, you usually take two dose given 6 to 12 months apart. 2 dose given 6 to 12 months. Then from 15 years or older, usually take 3 dose over about 6 months. Then patients with weak immune system and HIV are advised to receive 3 dose regardless of their age. regardless of their age, will receive a screening constantly, 3 doses regardless of their age. So thank you for today. Next video we'll talk about other infections too. Please don't forget to like, share and subscribe. Thank you. Bye.